When it comes to providing life-saving breast and cervical cancer screening and treatment, there are too many arbitrary loopholes that remain in California for women, and they fall into that trap. It's time to close those loopholes. If you're low income, underinsured, younger than 40 years of age with a symptom for breast cancer, the state is not currently helping you. If you've had a reoccurrence of cancer in the same breast, the state is not currently helping you. If your treatment is taking longer than 18 months for breast cancer or 24 months for cervical cancer, the state is not currently helping you. And we're going to change that with AB 1795. This bill will make sure that all California women have access to mammograms and early cancer treatment, regardless of their age, what kind of cancer they have, or where they have it, and how long it takes to fight it. And I want to thank the 7 California affiliates of Susan G. Komen for helping me do this. AB 1795 closes 3 loopholes. Right now, the state's Every Woman Counts program provides mammograms and cervical cancer screening to low-income and underinsured women. But only women who are 40 or older can receive breast cancer screenings. For example, if a 35-year-old woman goes to her annual OBGYN checkup and her doctor discovers a lump in her breast, her mammogram would not be covered. That's scary because we know that breast cancer can be far more aggressive in younger women, in younger patients, and more likely to lead to death if not diagnosed early. There's no good reason younger women shouldn't also be covered.
I'm a 2-time breast cancer survivor. My first journey was in 2008. I was a single mom with 2 beautiful daughters. Carrier a lump in my breast without insurance. I'm a blessed person, I can say, because I was able to get covered. I have my treatment, my surgeries, chemotherapies, and my breast reconstruction because of the program, Breast Cancer Cervical Treatment Program. I was diagnosed with breast cancer, stage 2, at the age of 35 years old. Fast forward a little bit, in 2013, I was diagnosed again with stage 2 breast cancer. I can say that I'm thank God right now because it was in my other breast. Being a survivor, I hope to see women to have the access to receive the services that they need, to detect and treat their cancers early. As we all know, there's no cure. We're fighting to find the cure and hope one day we'll make it happen.
Breast cancer can and does hit young women. Breast cancers can and do recur, and treatment for breast cancer is not short or straightforward for many. That's why the expansion of the BCCTP and Every Woman Counts program are absolutely crucial. Having cancer once is hard enough, but dealing with a recurrence is devastating in and of itself. The last thing a woman should be worried about if she is facing cancer for a first or second time is how to pay for treatment, or if she can squeeze in her treatment within the 18-month window. The last thing an uninsured or underinsured young woman with a breast lump should be weighing is whether to pay the utility bill and buy groceries for her family or pay out of pocket for her imaging and biopsy that she needs.
Right now, if the Every Woman Counts screening detects cancer, the state's breast and cervical cancer treatment program kicks in and provides treatment, but not if it's a reoccurrence of the same type of cancer in the same part of the body. That makes no sense. Let's say a woman in this program has breast cancer in her right breast and then goes into remission. If her cancer later comes back in the same breast, she would be denied treatment. Yet if her cancer comes back and has metastasized into her lungs, her treatment would be covered. Makes no sense. This is an arbitrary line drawn in the program, and there's no good reason for it. So 1795 would fix that. Right now, the breast and cervical cancer treatment program stops providing treatment after 18 months for breast cancer and 24 months for cervical cancer. Many women don't need treatment for more than a year and a half, that is true, but not all women are alike, and not all cancers are alike. Some women need more time for treatment. 1795 would give that time to them. The best, most effective way to keep Californians healthy is to detect problems early and begin treatment immediately. Unfortunately, those principles aren't always followed in state law. AB 1795 would fix that. I want to thank the numerous organizations that have sent in letters already to support AB 1795. With their help, we will fill the gaps and extend vital health care to more California women.